My name is Melissa Yee, and I'm a physician here at Reproductive Medicine Associates of New Jersey. I went to Wellesley and Dartmouth for undergrad, and then I took a year off and did some research at Children's Hospital in Boston. I then decided to pursue a medical degree and went to the University of Vermont College of Medicine up in Burlington, Vermont. And then my husband was working in Manhattan, so we moved, or I accepted a residency and fellowship at York-Presbyterian Hospital, which is part of the Weill Cornell medical system. I then accepted a position with IVF New Jersey, and I've been there for over 12 and a half years. I grew up in the Hudson Valley in New York State, and it was an amazing area to grow up in. And then when I was in high school, I was lucky enough that my dad had a job in Japan. So we lived in Japan for a period of time, and while I was there, we had the opportunity to travel to Europe and Asia, which was a really unique opportunity for me. I'm married and I have 3 kids. My oldest is 15 and the youngest is 4, so there's a pretty big spread there. And my last child I had when I was over 40. So, you know, I know that being an older mom, you're worried about your body and if you can have a healthy pregnancy, and then also in terms of worrying about the health of the baby. So I went through kind of all those things. So I think when I see patients who have the same types of fears, I can relate to them and kind of help them get through some of those fears that they have. I like classical music because that's what I was brought up playing, and my kids like hip hop and, you know, all that pop music. So it's always a fight over what kind of music is playing in the house. So. We're also a really athletic family. My husband and I both were athletes through high school and college. So we try to do as much as we can outdoors with the kids in terms of hiking, skiing, biking, swimming, tennis. I mean, you name it. Whenever we can be outside, we try to be outside with them. So the first question is usually, why haven't I gotten pregnant? At that first visit, I really try to explain to them what is involved in terms of getting pregnant and how do we go about finding out what the problem is. At the second visit, after we've done the diagnostic workup, it's usually, well, can you get me pregnant? And usually most of the time, there's something that we can do to get them pregnant. And then I feel like it's my job to then start explaining the different treatment options and kind of guiding the patients through what I think would be the best option. I think the technology has advanced so much over the past 15 years that it's now possible to feel comfortable recommending single embryo transfer, especially with the CCS testing of embryos to pick out the most normal embryos to put back. And I think that has been probably one of the biggest advances in terms of the IVF technology. I really love practicing medicine, and I love the field of reproductive endocrinology. I think primarily because I love my patients. I love the relationship that you form with a couple during this whole process in terms of helping them diagnose their issues and then helping them choose the right treatment path. And then if they do become pregnant, it's really amazing to get those birth announcements or run into their families when you're at the supermarket. Having a family, I appreciate having children, and I understand like how much they can add to your life. So when patients come in and they also want to start a family, I recognize how important it is to them. I think one of the things with infertility is sometimes patients, they may be trying to get pregnant, but they're just too afraid to go see someone. I think it's important for patients to know that even though they're afraid and they're worried, I think information is power, and it's important for them to come in and see someone and not think that we're only about IVF. We are about other things as well, and most of the time we can help you.